More than half of all Americans depend on their employers to sponsor their health insurance. But with millions now unemployed because of the pandemic, more middle-class families are now struggling with no income and no way to pay the doctor.
We lost our corporate health insurance, and that during a global pandemic is really not where you want to be.
AUDREE Hall was diagnosed with skin cancer 3 months before losing her job in August. Her work-sponsored insurance covered her surgery, but now she's uninsured and unable to pay for follow-up appointments. And just this week, her husband was diagnosed with COVID.
All around me, people are losing their lives or having long-term effects from COVID. And so as a mom, as a parent, as a wife, as a citizen, how can we have close to 500,000 people be gone or not have the assistance to get the right health care?
28 million Americans did not have health insurance before the pandemic. Now that number has grown by an estimated 5 to 10 million. Biden's executive order will allow some of those people to buy government-subsidized health insurance through the Affordable Care Act.
Of all times that we need to reinstate access to, affordability of, and extent of access to Medicaid is now, in the middle of this COVID crisis.
But the help won't reach all those who need it. In fact, AUDREE Hall says the Affordable Care Act plans are still too expensive for her family, and they don't qualify for government programs intended for the poor. They'll remain in the gap of the uninsured middle class.
Every family should be able to see a family doctor whenever they need to. That should be a commitment that our society can make to every family in this nation.
Leaders in Washington have pledged time and again to reform the healthcare system, but for years they've failed. Experts say with the pandemic raging, the need for action is more clear than ever. Heidi, Zhou-Castro, Al Jazeera.